Hello, everyone. This session is about the new technologies on public health. And we are going to use the slides prepared by through the collaborative effort of the Family Health Nursing team. And we'd like to acknowledge Dr. Sugay on this particular topic for the slides. So again, our topic is about the new technologies on public health. When we talk about public health, we all know that we are focusing primarily on primary healthcare. And in primary healthcare, we have our objectives, as nurses who are taking care of the public. And these are preventing and promoting health, improving health-seeking behaviors among the individual patients in the community, their families, the population groups, and the community as a whole. And also, one of the objectives in public health is to strengthen the health systems. Now, in promoting health among the public, it is achieved through the Kalusugan Pangkalahatan or the universal healthcare. I'm sure that you have heard about the universal healthcare law that is directed towards ensuring the achievement of the health system goals for better health outcomes. Also, to sustain health financing and to make the health system more responsive to the needs of the people. And while doing this, part of the focus also is to integrate electronic health innovations in the field of nursing, which is our topic for discussion today. Now, after this discussion, you are expected to define key terms on technology, apply innovations in healthcare setting, and then perform safe and efficient nursing activities for individuals and family in the community. On health technology, it is defined as the application of organized knowledge and skills in the form of devices, gadgets, medicines, vaccines, procedures, and systems that are developed to solve a health problem or to facilitate the resolution of health problem or achieving better health outcomes, and consequently improve the quality of lives of the people. Okay. In your next year, when you take up your nursing informatics, you will learn more, about the practice of applying health technology in patient care management. Now, according to WHO, there is a need for health technology assessment. So what is health technology assessment? Health technology assessment is the systematic evaluation of properties, effects, or impacts of health technologies and interventions. And it covers both the direct intended consequences of technologies and interventions and their indirect unintended consequences. Right? According to the health technology assessment findings, it was revealed that these assessments of health technology in most responding countries appeared to focus primarily on safety and clinical effectiveness, followed by economic and budgetary considerations. And unfortunately, at this point, little consideration was given to issues of ethics, equity, and feasibility. So what does it mean? In utilizing health technologies from those countries who are already using it, their focus is more on clinical effectiveness, particularly efficiency. I'm sure you're quite familiar how technology helps us to make our work more efficient, right? And so along with this efficiency in delivering patient care, safety is also ensured because the interventions are timely. No, yun. However, there are economic and budgetary considerations. So, of course, logistically wise, application of health technology uh, in public health would require uh, would require financial support, no, to be able to fund, no, these technological advancements. But then again, in terms of equitable availability, uh, according to studies, little consideration is given to it yet. Because, of course, countries all over the world have different economic status. No, we have different economic capabilities. So, in the first world countries, of course, the use of health technologies uh, would be there, no, would be available. But in a third world country like ours, although there are current developments in the use of electronic health records, no, in public health, but then many things are yet to be done, no, to make it more available for everybody. Okay. Um, Governance and linkage between these health technology assessment units or networks with policy authorities is also another pertinent findings. No, indeed, there is a need, no, for collaboration between public and private organizations so that the application of health technology in public health would be feasible. Okay. Yeah. Other findings include impediments to strengthening capacity includes lack of qualified human resources, which appeared to be the main barrier for producing and using health technology assessments. Uh, in in employing, no, or in utilizing health technology, of course, uh, we would need manpower who are capable, who are knowledgeable, who are well versed, no, in using those technology. Although in the United States, uh, the nursing informatics is one recognized field already, no, but then here in the Philippines, we have yet, no, to see the recognition and the development in the fields of nursing informatics, where nurses where nurses take advanced courses on informatics, no, on the use of technology in patient care management. So as long as we have we are short, no, of manpower who will be capable in yeah, in using and producing health technologies, no, in public health, then maybe, you know, it would take a longer time para to realize, no, the efficiency and the effectiveness that health technologies can offer in terms of patient care management. Also, another pertinent findings is that most countries did not have academic or training programs to build HTA capacity, or health technology assessment capacity. And just like what I've said, um, although nursing informatics, no, in the field of nursing, although it gained recognition already, no, in the United States as an advanced nursing practice, but here in the Philippines, we have yet, no, to see um, recognition, development of more sound and responsive curriculum to nursing informatics requirements. Although at present we have already integrated nursing informatics as a separate subject in the nursing curriculum. That's why next year you will take up one course, one subject on nursing informatics. It's a 3-unit course, 2 units lecture and 1 unit RLE. So that would also enable you to apply your not the knowledge on informatics to develop maybe a prototype of an electronic health record, so that you can also see how electronic health records can render a nurse's work more efficient. Yeah, but yes, we need to we I know we are have yet to see the impact of this integration in the curriculum. Hopefully, in the future, we will have more capable nursing informaticists in the Philippines so that we can contribute in this health technology assessment capacity. Also, another finding is that the result of the survey would aid in the identification of areas that need interventions. And this is good, because it brings to light areas of improvement, or those areas that needing or requiring intervention, so that the institution or the organization, or the field will become more ready, to utilize health technology, particularly right now in public health. Okay. Now, I have been mentioning about the use of technology in the Philippines. So, what about us right now? The application of e-health, is actually mandated already by the Department of Health. E-health serves as an information gateway for e-health initiatives in the Philippines, which creates a space for lifelong learning of health practitioners to improve the quality of life of the people. So right now we are already integrating nursing informatics in the nursing curriculum. So we hope to be able to contribute on these e-health initiatives in the Philippines. Also, e-health refers to the use of information and communication technology in support of health and health-related fields, including healthcare services, health surveillance, health literatures, and health education, as well as knowledge and research. So, the application of technology in healthcare, is too wide. There are so many areas where we can apply technology and make our work more efficient. And we are really looking forward that we as nurses, you as future nurses, will, since you are digitally natives, you will be able to use this information and communication technology in patient care management. Okay. So what is the vision of the Philippines in terms of e-health? By 2020, e-health will enable widespread access to healthcare services, health information, and securely share and exchange patients' information in support to a safer quality healthcare, more equitable and responsive health system for the Filipino people by transforming the way information is used to plan, manage, deliver, and monitor health services. So, ano nang date natin ngayon? It's already 2021, and 2021 is about to end. Actually, somehow the Philippines was able to realize this vision, since e-health in public hospitals are already integrated. There are some hospitals can exchange patients' information, of course, under strict protocols to also protect the confidentiality of this information. But somehow we are able to come up with applications and electronic health records that can be accessible by the different institutions. No? So the patient information exchange system is in place, no, in public health actually. Okay. Hmm. Also, the strategic vision describes the Philippines health system that has been enabled by e-health. It shows how e-health will be used to address health system's priority goals and challenges to deliver health outcomes. And the overall goal is to achieve health system goals of financial risk protection, better health outcomes, and responsive health system for the Filipino people, particularly right now, no, that we are having experiencing this pandemic, no, this COVID-19 pandemic. Indeed, there is a need for the application of technology in facilitating provision of healthcare to the people. And we have seen that. We have seen how the Department of Health was able to coordinate, no, a response system in order to govern the public, no, in and to control, no, to provide control measures so that uh, COVID-19 no, would be COVID-19's effect no, would be at least manageable for everybody. So yes, if you try to check no, the DOH website, the corona trackers, not only locally here in the Philippines, but also globally, no, when you check the corona tracker in WHO and also read no, their response system, how they have been responding no, to the needs of the people. So it's all there in their website. No, and I'm sure when you were also studying epidemiology, you have seen no, how information and communication were facilitated through the use of technology that eventually has helped people you know, to be to feel a bit safer amidst this pandemic. Okay. And particularly the health information dissemination, which is very important at this point. Also, those people who are in their homes, especially during the lockdown, no? So e-health has been, has provided a means for people to contact, no, or to to get primary health care through telehealth. No? So they're able to call the doctors, and the doctors through Zoom conferences uh, are able to still do the consultation with the patient, no, and able to provide advice no, regarding their health, no, particularly on how to manage their COVID-19 symptoms. Now, on e-health strategy, it was recommended no, that e-health must serve the needs of the client or person. So it has to be client-centered, person-centered, and collaboration and partnership with key healthcare stakeholders are critical in realizing the country's e-health vision. Also, users must be involved at all phases of development and implementation to gain commitment for this. Um, and yeah, I hope, no, as you also future nurses continue to learn about the use of technology in healthcare, would be able to contribute to these strategies in the future. Other strategies includes uh, an approach, no, a strategic approach in terms of phases, which enables more focus and judiciously and efficiently make use of resources to achieve the e-health vision. Also, e-health activities must be aligned or harmonized without controlling healthcare providers to implement local e-health solutions. Also, the presence of entities that have already started e-health must be recognized so as not to constrain their continuing advancement and gain also their support. Okay. Other strategic guiding principles includes human resource can be made available by building capacity to implement the e-health agenda in the country and promote transparency and public accountability. Also, implementation of e-health must comply to relevant laws and regulations. And investments must be made on areas that deliver the greatest benefits to health consumers, healthcare providers, and healthcare managers, and ensure no duplication in terms of time, effort, and resources. Okay. Now, the components of these strategy are actually the building blocks to achieve the vision. And these important components would include, of course, governance, which is very important, legislation, policy, and compliance, not as so that they the so that the activities have legal basis supported by policies and would necessitate compliance among the users because of this legal basis. Also, standards are very important to be clear. So the users and consumers would be guided, of these standards and interoperability. So the different institutions, different users and consumers would know how to act, in in the course of employing the health technology and healthcare. Also, dynamic strategies, sound strategies, and investments must be made. Infrastructure is also very important for successful implementation. And syempre, the human resources who would be operating, controlling, using, planning, implementing the e-health strategies, and of course e-health solutions, that would aid in troubleshooting whenever problems occur. So e-health solutions must be available. Okay, so these are important components in achieving the vision, the e-health vision of the Philippines. Specifically for governance, it involves directing and coordinating e-health activities at all levels, like hospitals and healthcare providers. The critical areas in governance would include management of the e-health agenda, stakeholders engagement, of course, clinical safety, management and operation, monitoring and evaluation, and policy oversight. Right? On legislation, policy, and compliance, it involves directing and coordinating. Also, it includes all legislation, policy that would support direction and coordination of e-health activities. And these legislation and policy, and rules must bring into light, these critical areas as well, that are the same critical areas for governance. Okay. On standards and interoperability, it involves promoting and enabling exchange of health information across geographical and health sector boundaries through the use of common standards on data structure, terminologies, and messaging. Kaya nga a health agency in Samar, if able to have access, on the patients, or to provide input on the patient's health information about their patient. So imagine kung nasa Samar siya, and then suddenly this patient in Samar will go to Manila. Will there be a chance also for other institutions in Manila to be able to view, the existing patient's health information? Now, the standards and interoperability, as an important component, would help, promote this exchange of health information. But of course, in exchanging health information, dapat yung structure is the same. Also, terminologies. Kaya nga in nursing, it's very important that you as student nurses, no, it's very important that you are very familiar with our nursing language. No, because this is the same language that you will be using to communicate with other healthcare practitioners. And and we have to ensure that our nursing language is understandable also among the other allied healthcare workers. Okay? So yun. So one example, of standards and interoperability is the implementation of software certification or accreditation, where e-health solution must comply to be certified as able to exchange health information. So we do it these patient health records, electronic records are not just developed randomly. No, they must also undergo certification to ensure that these health records, electronic health records, are observing proper protocols, in protecting also the privacy and confidentiality of the patient. So there will be no misuse, no room for misuse or abuse, of this health information. So a certification or accreditation is warranted. Also, this component develops, operates, and sustains the national e-health vision. Because basically the standards guides this practice. And these components support the development of a strategy and plans to serve as a guide in the implementation of the e-health agenda. So every strategy, every plan must be anchored on these standards. All right? On infrastructure, it involves establishing and supporting health information exchange. So examples would be sharing of health information, again, across geographical and health sector boundaries, and implementation of innovative ways to deliver health services and information. Okay, so through electronic health records and through the many ways on how you share health information. So it could be in the form of a video, a blog, but we have to make sure, we have to ensure that the information, that are being disseminated are correct. Okay. Infrastructures also involves physical technology and software platforms, services and applications to support health information exchange. Okay. So developing software platforms, and also applications would be a great help, a very good infrastructure to support e-health and eventually to help us realize our e-health vision. Human resource, we mentioned a while ago, pertaining to manpower, to develop, operate, or implement the national e-health environment. And the manpower would surely, of course, involve health workers, not only those computer capable persons. Mga computer engineers or those who are, hindi lang sila. But basically, we as health workers should be more involved because we know very well, the health system and also the patient care management system. And developing software and applications must integrate, this healthcare system. So so health workers who will be using e-health in their line of work, healthcare providers, information and communication technology workers, and others should be involved. On e-health solutions, it would require services and applications to enable widespread access to healthcare services, health information, health reports, healthcare activities, and securely share and exchange patients' information in support to health system goals. Example of this are yun nga, the electronic health, medical or personal records, electronic referrals, medications management, distance learning and electronic resources, telemedicine, mobile health, adverse event monitoring, disease surveillance, and others. Okay. On medical innovations, these are important key terms that we need to remember. mHealth is also mHealth um, refers to the mobile wireless technology that has the potential to improve the quality and coverage of care, and it increase access to health information as well as promote positive behaviors to prevent the onset of disease. Okay, so imagine a diabetic patient, logging in the mHealth application, recording the food that she had been taking on that particular day. So she would be able also to monitor how much calories, or if she or he is taking the required daily allowances, for caloric intake. So yon. And also yeah, the glucose levels, etc. So including the learning resources on diet, exercise, and others, on how to best manage their condition, their chronic condition, their diabetes. Another key term is telemedicine. Telemedicine is a term coined in the 1970s, which literally means healing at a distance. So the use of information and communications technology uh, is uh, is employed to improve patient outcomes by increasing access to care and medical information. Another key term is electronic medical record, which is the digital version of a patient's paper chart, and it contains patient's medical history, diagnosis, medications, treatment plans, and laboratory results. Right? So there are a lot, of things that we can discuss about e-health, but I would reserve that for next year, when you take up your nursing informatics. Okay? So thank you everyone for listening. If you have questions, feel free to message me. Thank you.